people are so grateful for the work that healthcare workers do. And we often don't realise that. To us, we're showering someone or we're helping them, attend their activities of daily living, or, we're changing a stoma bag, or, for young people, we're helping them at their most vulnerable time, or we're attending that accident, or, we're performing CPR on someone that we don't think is going to survive. And someone's always watching and someone's always learning, and no matter whether you like it or not, you're a role model to the community.
Well, welcome to the show, everybody. I'm really excited to get into the episode today. My special guest, Michelle, who I'll introduce in just a second. But if you are doubting or unsure as to whether healthcare is an avenue for a career, an exciting career with many opportunities, then you're going to want to listen on. Today, my special guest for the show is Acting Executive Officer, Director of Nursing for New South Wales Health at Murwillumbah District Hospital, Michelle Havell. Michelle, welcome to the show.
Thanks for having me. I feel very privileged.
Awesome. It's a great pleasure to have you. I'm just going to give you a bit of a talk up right now, so you don't have to talk up yourself. But Michelle, you've been 18 years in health service management.
Correct.
We haven't had anybody in that management role on the podcast, so I'm really excited to talk to you about that whole sector within the health service. You've worked on some pretty large-scale projects, including the Gold Coast Uni Hospital Build and Move project and the Com Games, 2018 Com Games at the Gold Coast. We want to talk about that and your experience in the health team in that. And you're a student mentor at Griffith Uni. You're a published author. The list goes on. And just this year, you became an Associate Fellow of the Australasian College of Health Service Managers.
Correct, yes.
Wow.
Yes.
I bet you didn't think all this would play out when you started your healthcare career.
Never in a million years. I was just a nurse. Never thought anything beyond that.
Amazing. So we're going to talk a bit about your career journey and then obviously your insight and perspective on, particularly for people starting out in healthcare or studying healthcare, and maybe help to open up their minds as to what is possible, and particularly for those who may feel they've got some leadership abilities. So we're going to talk about that whole area of management within healthcare. So that's pretty exciting. It's just a real honour to have you on the show, and thank you for your time.
Oh, no worries. Oh, it's my pleasure.
All right, but first of all, before we get into all that, you're a twin.
Yes, correct. I am a twin.
That's dear to my heart because I have twin little boys, 4-year-olds. You remember what that was like?
Yeah, having 4-year-olds, I do. 1 4-year-old at a time.
1 4-year-old at a time. That's preferably how you would do it. But not only are you a twin, but you married the same man.
Well...
Okay.
Yeah.
Let's clarify that.
My twin and I both are married to Michaels. So,
How confusing does that get for friends and family? And have you ever used that to your advantage to have fun with people?
Well, in our family, the saying is my Michael. So my sister started my Michael does this. So now I have to say my Michael whenever I talk about my husband. So
okay.
It's a bit of a saying, my Michael. So it's very strange, I know, but I just want to go on record that I married my husband first.
Right, okay.
And
there it is. Great. And so can we talk about now your passion, first of all, your passion and sense of purpose in healthcare, and then we want to go through your career, just a brief overview of your career and your current role, yep. and then some of the things that you've been involved in along the way. But why do you love working in health?
Well, I really like that you said, what's your sense of purpose? Because if I start from the beginning of my journey, I graduated high school and I went into nursing basically because I didn't want to be a checkout chick. and I thought, well, I have to do something with my life. And I really didn't get a sense of what nursing or what healthcare, what it really meant.
Yeah.
And I guess throughout my professional journey, I've matured and I've changed my sense of purpose. So at the beginning when I graduated, I just wanted to graduate and get some money and, sure, I wanted to learn all about healthcare and, how to care for people, but it really didn't start to mature until probably I was in charge of, other healthcare providers.
Okay.
Probably until I had 1 to 2 years experience under my belt, and I really got a sense of my role within that healthcare team. And then once I had children, my priorities and my sense of purpose changed. And then when I came back from work, from having children, they changed again. I was leading a different team. And throughout times in my career, my sense of purpose changed from just wanting to earn money to wanting to really be one of the best nurses I could ever be, to making sure that the nurses that worked with me knew what their role was and them wanting to be the best nurses that they could be to deliver that safe care. Do you know what I mean? So it's to me, in the position that I'm in now and the previous big positions that you mentioned before on the project roles, it was all about delivering safe care and being safe. So when I say being safe, it's not only my staff and the staff that I work with delivering safe care, it's that what is it about them that's safe as well? So ensuring that they're safe. So I guess that's my sense of purpose, developing those people, because if I develop and look after those people and those staff, then they're going to deliver the best care possible and make sure it's safe and that they're safe and their team's safe. So I guess that's my sense of purpose in health at the moment, and it may change into the future. And for others, their sense of purpose is different. So you mentioned that I was a Griffith Uni mentor, and I do have a lot of colleagues still come to me for mentoring outside of the university, and they say things to me like, I don't know what to do with my life. I don't know where to go in my career. I don't know, I want to do this, but I'm not too sure. And I always say to them, what's your purpose? Why do you want to do that? Why are you applying for this role if you're telling me you want to be an educator and the role is management? What is your purpose? You've got to find your purpose and your passion in order to move forward. And I really love healthcare because it's diverse, it gives you flexibility, and after that 1 or 2 years that you consolidate all your theory once you graduate from whatever degree or course that you're doing, that world's your oyster. You've got that experience now, you've consolidated your skills, you can go anywhere and do anything with that. So that's the beauty of health. Amazing. It really is, yeah.
Amazing. It's awesome to hear your passion. So what I want to hear now is just get an idea of, can you tell the story of of course, because it's it's wide and varied, but your career journey in healthcare, and then before describing your current role as Acting Executive Officer, Director of Nursing.
Sure. So as I mentioned, I graduated high school, 17, and I went to Griffith University straight out of high school. I decided to do a Bachelor of Nursing, and I didn't know what it was about, but I ploughed through and I finished the Bachelor, and I obtained a position as a registered nurse at the old Gold Coast Hospital. And that was way back in 2000, so a bit of a while ago. And I obtained a position in the gastrointestinal surgical unit, and there I stayed for pretty much for the most of my nursing career. And
you gave a nod to me there because we talked about this. I've got a bowel disease and I've had quite a number of surgeries, and so I mean there's a connection there. And I mean, part of why I love talking about healthcare is because I wouldn't be here without quality healthcare. And it's saved my life a number of times. I've had emergency surgery, and it's just inspiring to see and be a part of the next fleet of healthcare providers. So, it's awesome to hear that you've had experience in that. I think that's just to connect in that way.
Yeah. Well, you're very lucky then because some of the people that I've seen come through have been very sick. So you're very lucky.
Yeah. I'm doing so much better than I could have hoped for.
Wonderful. Well, I stayed there for pretty much most of my nursing career. I soon became the nurse unit manager of that unit. I think I was about 26 at the time when I became the nurse unit manager.
Wow.
Which was a bit of luck and a bit of hard work, I think.
Place,
a
right
bit of
time
both.
And a bit of both.
Yeah. And I think at the time I was probably the youngest nurse unit manager at the old Gold Coast Hospital, which had its challenges, but I stayed there for quite some time, and I had my babies. And when I returned to work, as most mums do, they don't want to come back to work full time. And at the time, Gold Coast Health wasn't quite mature enough to allow part-time managers to come back. So this opportunity arose with the Gold Coast University Hospital project team to be one of the transition managers there. So, part of a project manager within the project team, and my portfolios in that were family, women's and children's, so the huge, massive clinical divisions, and my responsibilities were family, women's and children's, which was probably something close to my heart at the time because I had 2 young ones at home. And I had some other minor portfolios that I looked after as well, but one of the big ones getting closer to the move that I looked after was the move workforce. So my role was to be in charge of organising all the healthcare escorts for the move.
Okay.
Yeah, so that was pretty interesting.
Yeah.
And then after that project finished, I did some minor project roles within the new GCUH and eventually ended up going back to my ward, which was now in the new Gold Coast University Hospital, for a couple of, I think it was about 12 months. And it was during that time that I led the inaugural Gold Coast 2015, it's a bit of a tongue tie, Nursing and Midwifery Symposium. So it'd never been done before. So it was wonderful. It was a wonderful conference that we undertook. And it was just a wonderful opportunity for the hospital, and we showcased the hospital and nursing midwifery services, and it was, still relatively brand new. Then in 2016, another opportunity came. I've been very lucky in my career, I have to say, where a colleague of mine had already been seconded to the Commonwealth Games by Queensland Health, and she contacted me and asked me if I'd like to come across. So in between 2015 and 2016, I held some, acting director positions in digestive health and whatnot. But when the Com Games position came up, I had to take the plunge, so to speak, because it was an amazing opportunity. And that's where I stayed for 2 years until just after the Com Games. And then I went back to Gold Coast Health into my nurse unit manager role. And after 20 years at Gold Coast Health, last year I decided it was time to move on, and I applied to New South Wales Health and was successful, and that's where I've been for the last 13, 14 months. Yeah.
So what does a director of nursing, an executive officer in a hospital do?
I know, it's such a mouthful, isn't it? So in my current role, I basically look after the whole facility. So it's not just nursing and midwifery, it's medical, nursing, midwifery, operational services, food services, administration, medical imaging, you name it, whatever goes into that hospital that all reports to that role. So essentially that role is ultimately responsible for operationally managing that facility, but also for strategic planning and management of that facility.
Okay. So
to me, you're creating the building blocks of services for years to come.
Wow.
And I guess we'll get onto it later when we talk, more about the effects of COVID and whatnot. But that role needs to be at the forefront of whatever is contemporary happening in the rest of the universe, so to speak. Yeah.
Amazing. I am reminded of a picture that my daughter drew just a couple of days ago, and I wish I brought it in because I think she's going to be you, Michelle, in 20 years. My 8-year-old daughter, she drew a picture of this hospital just in pencil, and there was all these levels.
Yeah.
There was toilets on every level. There were X-rays. There was the birthing suite. There was the everything, you know.
Wow.
Yeah, everything you name. I mean, I wouldn't have had a clue drawing a picture of a hospital of all these different units as much as her. So I wish I'd brought that picture in. But but it's such a fascinating role. And I think with that foundation of healthcare, you've been able to now what largely seems like logistical and project management sort of skills and role within the healthcare, which is and planning.
Yeah. Absolutely.
Which is obviously foundational to the health service. And so it's just really interesting. And it just, it's exciting for people to think like, you know, going into healthcare that I'm not just going to be somebody, or not just the same, but there's so much on offer than bedside healthcare.
Absolutely. Yeah. I never in a million years when I was a registered nurse on that old ward, 6B at Gold Coast Hospital, thought I would ever get those opportunities. I mean, it to a certain extent, it relies on how hard you want to work in the first place as well, and it relies on your attitude and where you see yourself going. I guess some of it's luck, right place, right time, but the opportunities, if you're willing, if you're enthusiastic, if you want to keep going, are endless in health, and it's just a matter of where you look. Yeah.
So, with that in mind, if someone were to want to head in that direction and see themselves in leadership and management within healthcare, what are some of the skills and even qualifications that should be on their radar?
Yeah, so for my, when I went to nurse unit manager role, I really didn't have many skills apart from being a team leader in charge of shifts. And I learned really quickly how to lead and manage people, because people will tell you by walking out the door and you won't have any staff left. So I soon learned to listen to the people that I worked with. And I like to say that the people that I work with, because they don't work for me, I work with them. And so you have to listen to who you're working with, and you have to really take on board what they're asking for and try and meet their needs to a certain degree, and be prepared to stand up and be accountable and say if you can't meet their needs. So it's about that, for me, communication in leadership and management roles. It's about having a bit of foresight, as I mentioned in the director of nursing role. You have to have that contemporary foresight of what's going on around you in that healthcare sector, so that you can plan ahead and then be able to lead your team in a manner in which they will want to be led. There was something I saw a video, and I can't remember who it is. It was the US Secretary General. He posted a video on leadership, and he said someone once told him, you can tell when someone is a great leader if people want to follow you, if only out of curiosity, which meant to him that they trusted him enough, even if they didn't know what he was going to do next, to trust him enough to follow him into wherever he was going to go, because they were curious about what he was going to do.
Wow. So there's that trust, but there's also that sort of, this person's inspiring and I want to be where and go where they're going.
Absolutely. So for someone to have those qualities and to actually be engaging enough for people to want to follow you, that's very special. And that's something that I feel is a bit learned as well for me.
Yeah.
So I guess that's really out there. But in terms of skills and what other education and learning that you can do, for me, I did a Masters of Health Services Management, and that basically consolidated what I was doing at the time in my career. So it just demonstrated to me the evidence base of what I was doing. For others, it might be well, let's see if there's a succession planning program. Is there any mentoring? Is there any coaching programs? I got into Griffith University mentoring because I wanted to help others. I wanted to give back to the nursing community, I guess. That was something that I felt very strongly about. And that also led me to listening to my peers and listening to what people wanted and what people needed. And I think if you listen to others and you give them the time, then they're more inclined to want to come and work with you in that leadership and management role.
And what are those foundational qualifications before that?
Yeah, so look, I suppose it depends on what health sector you work in. For nursing, you do your Bachelor of Nursing, and then depending on where you work, which facility you work in, there may be some succession planning programs in those sort of areas.
Within the service?
Yeah,
okay.
So more like leadership development, that type of thing. Then it might be different for ambulance service. It might be different again for medical staff, et cetera, but it's a Bachelor of whatever or a grad cert of whatever you're in, and any formal within the service, and then you can go and do your masters in healthcare leadership or nursing leadership or healthcare management.
Yeah,
but that again, I think your masters just consolidates what you're already doing.
Yeah, it's a good point. Yeah.
Yeah, and at the end of the day, it's a bit of paper. You actually have to live that role. I think.
And you say you're lucky, but what were those qualities, skills, abilities that you held that allowed you, put you on the table at least for some of these roles and leadership roles that now has kind of built into, to where you are today?
Yeah, I guess I just worked really hard. I really did work hard. I did a lot. I remember saying to my husband, I've just got to work hard and I'll get somewhere. I remember saying that to him all the time. He's like, you're crazy, lady. So I did work really hard, and I remember if I promised that I would deliver something, I would deliver it on time. If I promised that I'd deliver it cheaper, I'd do that. If I said I would do something, I would do it. So it's about that integrity, having that integrity and building your reputation up. So I had worked with Gold Coast Health for a long time, so I knew a lot of people, and I built those relationships and I built that reputation through sheer hard work and that communication with people. So I guess to me that's probably what got me over the line. And then when I got those roles, I proved that I was worthy by working hard. That's what I put it down to. There was one, I remember one general manager at Gold Coast University Hospital. He introduced me to someone one day, and he described me as the woman that you go to get things done. So for me, that was pretty cool that he said that, and I guess that was my reputation. You just get things done, but get things done in a manner in which you bring people with you.
Yeah.
There's no point in getting things done only to when you leave they go back to the same old. So yeah, that's really important.
Awesome. So now, Michelle, talking about the obvious global pandemic that we're in right now and the role of the healthcare service, what changes have you seen in the last 12 to 18 months? Yeah,
so if I was to describe the changes that we've seen in health, I would say that they were all-encompassing, the changes. So when I think about this and I break it down, I think about workforce. So workforce first and foremost, we've seen some changes, particularly where I'm working at the moment, in decisions from the current workforce about whether they continue in the workforce. There was a lot of fear amongst the workforce, in the healthcare workforce where I am. Probably not so much within Queensland Health, but definitely within Northern New South Wales Health.
I think that would span most industries as well.
Yeah, definitely a lot of fear within that workforce. A lot of retirements went along. Also in the workforce, how we went went about our business. Like the rest of society, I feel as if, as a workforce, even though I talked about safety and delivering safe care, even us as healthcare workers, we were complacent. You know, I think the pandemic has reminded us how we can't be complacent in health, how we, have to do our 20 seconds hand washing. Even as nurses, you do like your 10-second hand. There, I washed my hands, but the pandemic reminded us very quickly that it wasn't good enough.
Yep, big wake-up call.
Yeah, absolutely. Absolutely, huge wake-up call. So that changed the way we started training people as well, and that changed the way, we couldn't do big groups of training for our workforce. We had to look at different ways on how we're going to train them. We had to practice donning and doffing gloves and gowns again because we thought we were doing the right thing when really we weren't. And there were holes in our practice everywhere. So as a workforce, I guess that was really humbling. Yeah. In other sectors of workforce, I feel as if the effects of the pandemic, we're not going to see for another couple of years. So, and I'd be so interested to see the research about this in a couple of years' time. So the pandemic will do one of two things in terms of funding, government funding for degrees, et cetera, for institutes like this and Griffith or the universities. The governments will either increase funding to health, which will aid in any graduates coming into the workforce, or they won't have enough money to do that, and that will impact on the supply of graduates coming into the workforce. Then we have different generations coming into the workforce now because of some have been displaced by COVID. So all the airline industry has been decimated. So we've seen some of those Generation X's, I guess, for want of not putting people into their boxes, changing their profession because they've had to. So we may see some of those coming into the healthcare workforce. We may see some Generation Ys that, for want of a better description, are loyal to and think about the community more so than the Generation X's. So it may be that the pandemic has made them really think about, okay, well, what can I give back to the community? So we may see them come into healthcare, but we don't know that yet for a couple of years' time. So that's the longer term effects of the pandemic on workforce. Then what we saw was resourcing. So all of our supplies, all of our, gloves, gowns, masks, there was a real panic because healthcare providers thought that we wouldn't have enough supply. And that was Australia-wide. And it's really made healthcare providers think, and those that manufacture healthcare resources within the country, how can we have these back at home? So that's been a huge impact. And, we saw rationing within healthcare services of supplies.
Wow.
Yeah, it was very interesting. Then as healthcare leaders, we found it very difficult to keep up with the communications. So you would have one day the advice would be this, and then the next day within 24 hours the advice would change. And to send that out to your workforce was very difficult and very confusing. And also sending it out to the public and the effects of the public coming into the healthcare system, those effects were very difficult to manage. Yeah. So, look, in a nutshell, it's all-encompassing, the effects of how we deliver care, how we build new facilities, or in the case of, say, Queensland Ambulance Service, how they deliver care in the facilities that they have, so their vehicles, or do they, you bet your bottom dollar they'll be planning about major pandemics and what they could do better in terms of how we manage those patients that are identified as potential COVID or suspected COVID. Facilities are looking at their hand washing facilities, the types of doors that they have on private rooms. They're looking at how the rooms are set out. in terms of model of care that they deliver.
Yeah.
How do we change this? Do we need more nursing staff? Do we need healthcare assistants to watch people don and doff? So all that type of thing. The pandemic has been a very big, as you said before, wake-up call to us in health. Absolutely.
And it's not just how you go about things, but it's how the whole infrastructure and structure of care has to change.
Yeah, absolutely. And we were, like, I'll admit it, we were complacent. We know what we're doing. Nothing's going to happen.
Yeah, well, a global pandemic is just a hypothetical, isn't it, until it actually happens. And you go, okay, this is happening, and it may happen and likely will happen again. And you know, we need to be prepared for that. Number one, healthcare. The front lines needs to be prepared.
Absolutely. And how do we give our people the tools that they need at the front line? What is going to keep them safe and our patients safe and our community safe? Yeah.
Interesting. Are there any new job roles or opportunities within that this pandemic has brought about? And I know you said that, you know, there'll probably be a couple of years till we actually see the full impact. But can you see any sort of avenues opening up for people that might be on their radar?
Yeah, absolutely. I think there'll be a focus on public health. There'll be a big push for public health, so any roles within public health. There is currently massive recruitment drives for COVID, a COVID workforce, I believe.
Okay.
That's what you would call it. And most of that's driven out of, if you look at Brisbane and Gold Coast, major metropolitan areas, still recruiting for COVID response teams.
Okay.
And they will keep those, anyone that applies to those positions, they will keep those files, and so they can mobilise a massive workforce at short notice.
Yes, okay.
Yeah, so there are positions out there that are coming about. There's a lot of project positions. If you're a clinician with project management experience, now's the time to start applying to those roles, because they're setting up, you know, pop-up vaccination clinics, pop-up testing clinics, or a colleague of mine is now in charge of the hotel quarantines in Brisbane, you know, so that's a major project team as well. So there's a lot of that project management going on around the traps as well.
Wow.
Yeah.
Okay, so let's turn our attention now. I'm really interested to hear about your experience with the Commonwealth Games on the Gold Coast in 2018. You're part of the health team there. Obviously, that's sort of out of hospital health service. So what was that whole experience like?
Amazing. I can't even, it just brings a big smile to my face every time I talk about it. Amazing. Like, we worked so hard. We worked amazingly hard, but it was so rewarding and such a privilege to be part of that experience. So part of my role, I was the medical manager for workforce resourcing and materials resourcing.
Okay.
So for medical services.
Yeah.
So basically my role was to plan and implement the workforce for medical services, and we delivered medical services to spectators as well as athletes.
Okay.
So it was the first time at the Commonwealth Games that the project management team, or the organising committee, had delivered spectator medical services. So we're virtually starting from scratch.
The first time in a Commonwealth Games? Oh, wow.
Yeah.
Okay.
So that it hadn't been done before, and we had nothing to sort of guide us. So it was very interesting times, and we kind of rewrote the book and gave a legacy for future Commonwealth Games, I guess, which is pretty exciting.
So what did they look like on the ground?
The medical teams?
Yeah.
Oh, yeah. They look like giant green people with big red backpacks. But on the ground, we had a fairly multidisciplinary team. We were looking for about 1,500 head count for games time.
Okay.
And that included any of the sports medicine guys, but the bulk of it was our spectator care teams. That was our biggest team for every venue. So we had, approximately 1,500 head count we were looking for. We had over about 5,000 people put their hands up. So probably one of the largest divisions, I guess, to have that many people volunteer for us. And then we had to cull them all. And that was a rigorous process, no doubt. We provided care to spectators and athletes for 18 venues and 12 training venues.
Okay.
Yeah, so a lot of venues, as well as what's called the Polyclinic within the Games Village. It's like a big super GP clinic.
Oh, wow.
Yeah. And what's called the Games Family Hotel. So where all the royals come and stay, we had to provide medical services, especially for them as well.
La-di-da.
The VIPs,
Right.
the VIPs. So it was quite extensive, the services that we had to provide, and the amount that the volunteers did. So 1,500 head count isn't that many really when you look at it.
No.
When you look at the volume of venues that we had to cover, but people, those volunteers, those medical volunteers, and there's inherent differences between paid staff and volunteers, people just put their hand up and they wanted to be a part of it. Didn't matter to them if they worked 7 days in a row. That's what they wanted to do. So they did work hard. Everyone worked really hard and they were giving up their time. These are people that were specialists in sports medicine, flying from all over the country, that gave up their time for that.
Wow. Volunteer.
You know? Yep, all volunteer.
Oh, amazing.
Yep.
And what sort of medical emergencies and illnesses were you treating? I mean, what was the scope there?
Yeah, so look, we were prepared for pretty much anything. We worked very closely with the Queensland Ambulance Service. Okay. In terms of spectator care and athlete care, we were prepared for everything. So I think I kitted out every venue with multiple AEDs. So every venue had multiple defibrillators placed everywhere around. I think I bought about 156 in the end. So what's that, 18 venues, 30-odd venues, that's 3 a venue? Yeah, so at the very least anyway. So we worked closely with Queensland Ambulance Service and we were able to provide that pre-hospital care to the extent that it was really high level. We had emergency physicians as part of our workforce in that spectator care model, and we worked out a minimum safe standards or safe staffing levels for care delivery. Okay. So what happened was, if we didn't have those minimum safe staffing levels, i.e. ED physician, 2 registered nurses, I'm making this up now, to open, say, the swimming, then the swimming wouldn't go ahead. So so once again, we had to ensure that we were safe and that we had enough staff to ensure that we were delivering safe care. And we did have a few emergencies. We had some emergencies because it was so hot in April. This time, it would have been around this time 3 years ago now. Yeah. Yeah, absolutely. There you go.
Yeah, very hot on the Gold Coast still.
Yes, it was very hot. And we had a few, I remember I was at the swimming one day. I think I was helping them out or something. And there was a lot of people leaving the morning session for the swimming, and the grandstands were in the sun, like full sun. Yeah. And the people were leaving from the morning session and there were people collapsing everywhere. So we had what we would call emergency response teams on the ground and radios, and it was, some of it was quite serious, and we did transport a few to hospital, but we had the teams there to safely deliver that care. Yeah. Absolutely.
Yeah. It sounds like a first aid tent on steroids.
That's absolute. That was it. The first aid tents were on steroids, and the service that we delivered was absolutely pre-hospital best. And Queensland Ambulance Service were phenomenal. They were with us all the way. So it's good.
Amazing. Was that one of the? I wouldn't say the highlight, but was that one of the more memorable events that day, or is there another one that comes to mind that you can divulge at all, where you felt like, wow, this is, this is something else?
Look, I pretty much every event, because I was lucky enough that I could go to any event, and every event that you went to, you just had to pinch yourself. I couldn't believe that I was actually there. It was amazing. Probably from one of the most memorable, probably not for the right reasons, is the marathon. The marathon to me was most memorable because it was a time when we as healthcare providers, everyone in my team, had to think about our practice. We reflected on our practice because, as you know, the Scottish runner collapsed probably, I think it was about 3 kilometres from the finish line, and he was in the lead, and then one of my respondents was responded to him. There was huge controversy about the medical response. Massive controversy. And there was protests and whatnot. And my team and I, because, that was my team on that day. So I was given the responsibility of the marathon because it was the last day of competition. Massive team on the ground. We had, volunteers every 2 kilometres around the course. Huge team. And I guess my team and I really had a really big reflection and debrief at the end of that day. And we spoke about what happened, what we could have done better. And really, when we debriefed, we really couldn't have done anything different. We had medical staff on board and they supported what happened. And to me, that was probably the essence of and the culmination of building that team and being part of that team. And that was really memorable in the end. It was good.
And that's what we drill into students, the post, the debrief.
It was really important.
What happened? What could we do better? Which you can always do. And that's how you improve as a service, right?
Yeah.
What went well? What could do better? What could we do better next time? But wow, to be involved in that.
Yeah.
People attending the event, the event and watching it on TV don't think about probably what's going on in the background, and that there was such a medical health force behind all of those events. They literally didn't run unless you had numbers and resources.
Yeah.
What an exciting thing to be involved in.
Yeah. Yeah, very lucky.
And I'm guessing that there'd be opportunities for healthcare professionals all over the world to be involved in similar events if they can get there.
Yeah, you just have to get your foot in the door.
Yeah.
And if I wasn't a paid staff member for GC 2018, I remember part of our role before the Games in trying to drum up volunteers was we would go to health organisations, and we went through to all the hospitals throughout the southeast and northern New South Wales trying to get volunteers on board. And I remember speaking to the emergency department at GCUH at the time, and I said to them, if I wasn't a paid staff member, I would volunteer. I would have volunteered. I would have volunteered because I want to give back to the community. This is something exciting that I can give back to the community for. And this is something that I want to show my children, that I'm not just a nurse, that I'm giving back to the community, and I want to be a part of something bigger than just being a nurse.
And you talk about the community a lot, and I think that's central to your purpose as a healthcare worker. And we alluded to that significance of the health service in the community, but I think it's probably really important and it's inspiring too to hear your perspective about being community-minded as a healthcare professional, and that giving you that purpose and significance, paid or unpaid. And that, I see it really lights, that passion and purpose for community really lights you up, lights your eyes up, and probably keeps you going through good days and bad days in the service. How does somebody learn that?
Yeah, how do you learn
passion?
it?
Yeah, how do you learn passion? It's a difficult question, but your attention? Where's your attention go? If you're in that space of, this is a career for me, it's a job for me. How would you inspire, young people or people just, on this path in a career in healthcare, but probably those lights haven't been turned on yet. What's the significance of healthcare and why should we be so community-minded?
Yeah, it's such a good question, Yeah,
big question.
Yeah, it's a great one though. And look, I probably needed to mature a bit when I was younger. And when I think back through my career, there are some significant times that I can clearly remember when the light bulb went on and I thought, oh, that's the impact I can have. That's the impact that I'm having on those within the community. That's the type of role model I want to be. Yeah. So one of those times I can clearly remember, it was probably in 2011, and I was the nurse unit manager of the old 6B at Gold Coast Hospital, and I was heavily pregnant at the time, and Cyclone Yazi came through Cairns, like decimated Cairns, you know. And the call came over from Cairns Hospital and Health Service asking for nurses to go up there to help out because their nursing staff had either been working full non-stop since Cyclone hit, or they couldn't get to the hospital to work their shifts because their places were decimated. So I had some young, highly skilled nurses, single, that were willing to go. And the call came out within 48 hours, they were ready to go. So I went to a T-shirt printer shop, and I had them print off 2 T-shirts. I sent 2 nurses, and it said something like Gold Coast to Cairns, Cyclone Yazi Nursing Relief 2011 on the back of their shirts, right? And I didn't learn this until they returned from Cairns, and they wore those shirts to the airport at Coolangatta Airport, and they told me that they were stopped by so many people thanking them for going up. Like that's, when they told me that, I thought, well, you're just doing your job. But when I reflect on that, people are so grateful for the work that healthcare workers do. And we often don't realise that. To us, you know, we're showering someone or we're helping them, you know, attend their activities of daily living, or, you know, we're changing a stoma bag, or, you know, for young people, we're helping them at their most vulnerable time, or we're attending that accident, or, you know, we're performing CPR on someone that we don't think is going to survive. And someone's always watching and someone's always learning, and no matter whether you like it or not, you're a role model to the community. So I guess for me, that was one incident that I thought, wow, that's pretty powerful. And I guess in another incident I thought of was during the GCUH Build and Move. We had a community open day. That's
the Gold Coast Hospital, University Hospital.
Yes.
Yep. Build and Move. Yep.
Yeah,
okay.
yeah. So I do use a lot of acronyms. I think it's a health thing.
2.0.
Yeah. Yeah, so...
you got to in health, don't you? You got to use acronyms everywhere, from doctors ABCD to all the way up to...
Oh, you do. Yeah. We had a community open day, and it was about 2 weeks out from us moving the hospital. And, you know, as the project team, we probably had about 20 project members there, and we thought, oh, yeah, some of the public might come in. We'll be right. We'll do a couple of tours from 8 till 11, and then we'll shut up shop. That's our community open day. Well, I don't know if anyone's ever heard about what happened at the community open day, but we had about 30 to 40,000 people through the doors that day. And when we expected the day to end, we couldn't end it. The day went from 8 till 4:30. And we did non-stop tours.
Wow.
So the Gold Coast University Hospital, it's got a massive foyer. And if anyone's ever been into that hospital, the foyer was shoulder to shoulder with people.
And I'm guessing it's a big area.
It was massive. And
did you say there was fights?
There were fights in the car park. Yeah. Because
for car parks?
Yeah. It just really hit home the importance of, yes, a new facility, but what we do as healthcare workers. There were people that were really invested in that hospital and really wanted to know how it was going to work, how we were going to staff it, what it looked like, where did they need to go on the day that they had to go there. That really hit home to me. That was a massive event.
Yeah. Wow.
Yeah.
So you've got a depth of experience in out of hospital and in hospital health care services, and like for somebody deciding at least where they want to head to, they're probably not going to know where they're going to end up because you know your career is a testament to that. But Can you allude to some of the differences in working within a hospital as opposed to pre-hospital or out of hospital?
Yeah, sure.
Health?
Yeah. For me, working in a hospital is very controlled. There are a lot of resources around. There's a lot of people to call on. If you're working pre-hospital in that pre-hospital space, you really have to know your stuff and be on the ball. There's a lot of people watching, as I said, which is a good thing. I mean, I don't mind people watching me. It keeps me accountable. And the resources around you are not as extensive as in hospital. So you have to really think about what you're doing and why you're doing it. And, you know, it's okay if you reflect on something you could have done better. That's part of learning. Yeah. And not to be too hard on yourself. But pre-hospital is, the resources are different that you have. And I feel like the teams are probably closer because of that. You're working in some really tough environments and you don't know about the unknowns. You know, when you stop at that accident, when you don't know who this patient is, you don't know their history. You don't know who's going to come around the corner, or you really have to think about your safety and your patient's safety within that pre-hospital environment. Yeah. We talk about safety in the hospital environment, thinking about your safety, but it's very controlled. You're walking into a patient's bedroom and there's no water on the floor, very unlikely, or you know where the Met call bell is. It's right there. If I can just press that if I need assistance. Yeah. But pre-hospital, there's no Met call bell. It's a radio and you're asking for assistance straight away. So there's good points to both and there's major differences in that respect, I guess. Your pre-hospital care, you're looking to stabilise and move straight away as soon as you can to get them to a higher level care facility. Whereas in the hospital setting, particularly in the units that I've been in charge of, you might stabilise them, but you might not move them. You might vent them on the ward, you know, before you send them to ICU. That type of things. Yeah. I think they're the two main differences for me.
Do you think there'd be a lot of value in having experience in both?
Absolutely. There used to be a program where the Queensland Ambulance officers used to come to the hospitals and do a practical session there. And it just gave them that look at the patient journey, that more robust look at the patient journey. Because as pre-hospital clinician, you see those patients for 45 minutes, an hour, enough to stabilise them, send them on their way. Whereas in hospital, you get to see that patient, how they're recovering, if they're recovering, or what sort of care is being delivered for that patient in order for them to be discharged and go home. Just gives you that good picture of where that patient's going. And I guess it allows you to look at the patient and their family as individuals just like you, rather than the patient that you're only treating for that short amount of time. Yeah, makes a lot of sense. So, in your opinion, this is a big question as well. We don't ask the light questions on Changing Lives podcast, but we're nearing the end. But what are some of the best assets that a healthcare provider professional can hold, skills and qualities that is going to, one, set them up for success, but also fulfillment in a sector like the healthcare sector? Yeah. So that is a really good question, and I had to think about that one. Look, I think self-preservation is number one, a bit of self-preservation. So there is an element of burnout within healthcare professions, and I think you need to know your limits and know when you need time out and what's good for you in terms of time out. So you really do have to look after yourself. That's number one. Because if you don't look after yourself, you're not going to enjoy your job. It's not meant to be hard to go to work. You're meant to want to go to work. So that's number one. There's been, it's a great profession in healthcare, but there is some really tough times. Let's be honest, it's tough. You know, I've seen colleagues leave the profession for that very reason, or burn out in the intensive care unit and have to leave. So you have to find what works for you in terms of time out and downtime. I would say flexibility. Be flexible. Be willing to be flexible. You have to be, I guess, because you're healthcare workers and you're shift workers, so you have to be flexible. Get used to not spending Christmas with your family every year. That can be of benefit sometimes, Christmas and families. I use that to my advantage anyway. Yep. It would be beneficial to be a reflective practitioner. Absolutely. The sooner you learn to reflect, the better you are going to be.
Great.
Yeah, absolutely. And also take that lifelong learning with you. So just because you get your degree or you get your graduate certificate, or, you've had that 5 years experience as an advanced care paramedic, don't stop. Keep being curious. Keep looking for that evidence base. Keep improving. And that's where that reflection comes in as well. To me, that's something that I like to keep doing as well. And if I look to all the recruitment panels I've ever been on, or, what I'm looking for in people when I look to hire someone, I like to think that I'm looking for someone that wants to keep learning, that's enthusiastic, that's driven, that's curious. We spoke about being curious before. And that reflects on what they do well and what they don't do well. Yeah, I guess that's about it.
That's excellent. Yeah. Would you have any further advice for anybody starting out in health, maybe in their study, thinking about a career in healthcare and looking towards it, wanting a job, a fulfilling job, a successful job, obviously, of longevity in the industry? Any other advice that you would give people?
If you're thinking of starting out, absolutely do it. It is, as we've seen in the last 12 to 18 months, it is a stable profession. It's worthwhile. It certainly fulfills my sense of self-worth. Look, it is certainly worth looking at those first couple of years when you're studying, and I can speak to nursing, if you're in the first year or two and you've got placement in nursing homes and you think, oh my goodness, nursing homes are a tough gig. This is not what I signed up to. Stick it out, finish it, get your 1 to 2 years experience. Then the world is your oyster. You can do whatever you like. Right. You just got to get that experience and that bit of paper under your belt, and then you can explore all there is out there in the healthcare sector on offer. Yeah, that's what I would say. It really is. I always say to the graduates, the world is your oyster. After give me 12 months, then you can work anywhere. That's great advice, Michelle. Thank you. It's been a privilege to have you on the show, and I'm even more inspired about working in this industry. And I thank you for your time. You've got to be a very busy person. So thanks so much. And I know that the audience is going to get so much out of this. So thank you. My pleasure. My pleasure. Thanks for having me.